Okay, welcome back to our video series on healthcare information technology. We will continue our video series with this video on chapter number 2, healthcare organizations and operations. First, the objectives for this chapter. Identify various healthcare organizational structures and their different methods of operation. Explain the use of codes of conduct. Identify EHR, EMR access roles and responsibilities for using protected health information. Describe the proper communication methods for use in the healthcare workplace. And list best practices in handling PHIs in the healthcare setting. We'll start off with challenges and opportunities. Now, a big challenge to healthcare IT is delivering healthcare to such a large population. There are so many diverse and complex organizations that offer healthcare. To develop one set of standards that will apply to every single kind is not easy. And that's why it takes time to implement all these changes. Another big challenge is getting information quickly to first responders, such as police, firefighters, emergency medical technicians. The longer you wait for treatment, the more serious an issue can become. So the sooner you get this information to the right people, the better. Another challenge would be in the operation of a hospital. There are numerous organizations that have a role in the patient's healthcare in the hospital setting. So it's not just the primary physician. There's the nursing staff, laboratory personnel, administrative people, multiple departments, multiple roles, all take part in the patient's overall healthcare experience. All right, now we'll talk about healthcare organizational structures and operation. Now, an organizational structure is the framework through which a group of people work toward a common goal. This also will define authority, responsibilities, communication methods, rights, and duties of that group. Now, there is a uniqueness to healthcare organizations. Even though they all have a common goal, to save lives, to reduce suffering, and to eliminate disease, but how they're organized and how they're structured does make different organizations unique in many ways. And another common trait between healthcare organizations is that they are involved with a stressful and demanding environment. All right, first kind of structure we'll talk about is a hospital. This is a healthcare organization that treats patients for injury and disease. And it usually will provide an inpatient or long-term care. A hospital can also provide outpatient care. This is where a patient is not admitted and does not stay in that facility overnight, but they are still being cared for by that hospital. There are multiple kinds of hospitals, including a general hospital, contagious disease, nursing homes, psychiatric, orthopedic, pediatric, and hospitals are divided into departments, and departments can vary greatly in size and can depend on the hospital type. Some common hospital departments you'll see: cardiac care unit, known as CCU, emergency room, ER. Sometimes you'll see this referenced as emergency department, or ED. Gynecology, GYN, intensive care unit, also known as ICU, medical and surgical departments, neurology, obstetrics, also known as OB, oncology, and pediatrics, also known as PEDS. Some other common departments: physical therapy, known as PT, psychiatry, also known as psych, and surgery, also known as OR. And apart from these major departments, you'll find supporting departments that assist those in the overall functionality of the hospital, including laboratory, pathology, pharmacy, and radiology. In addition to those departments we just mentioned, there are also some indirect support departments, including health information management, which is the medical records department, information technology, or IT, clinical engineering, also known as biomedical engineering, facilities management, which is the actual maintenance and operations of the hospital, of course, the administration, food and nutrition services, security, and material management. So multiple departments either have a direct or indirect role in the overall function of the hospital, which leads to the overall care of patients. The physician, this is the medical professional, and he or she is licensed by a governing body. Private practices, this is a single physician that provides care to individual patients. You can also have a group of physicians that are working together. This is considered to be a private practice if the group is physician-owned. You also have non-physician-owned healthcare groups, which are not considered private practice because they are owned and operated by a corporation. Another kind of organizational structure you can have is a nursing home. It's also known as a convalescent hospital. And this is equipped for patients that have long-term diseases. And a facility like this will address the needs of inpatients. And this is generally not equipped for acute care. So this is usually used for people who need a long-term care. So not just 1 or 2 nights, but for an extended amount of time. And these kinds of places, again, generally outsource support functions. You can also have a skilled nursing facility, or SNF. This is a requirement for a facility to receive Medicare reimbursements. And they must employ skilled nursing staff. Just like with Medicare, there are some requirements needed for Medicaid reimbursements for patient expenses. The patient must need skilled nursing care. The patient has a income and assets that are below a certain defined level. The patient must be a U.S. citizen. And the patient must reside in the state in which the nursing home is located. So another kind of organizational structure is an assisted living facility. These are designed for elderly people who need some assistance with the activities of daily living. And a facility like this has residents, not patients. And these kinds of places will generally do not have skilled nursing staff. And these are not eligible for either Medicaid or Medicare reimbursements. Another type of organizational structure you can have is home health care. This is where you have treatment of a disease or an injury in the patient's home. This will be staffed by non-medical and or skilled nursing professionals. And they may be reimbursed. It just depends on the certain criteria of that patient and that patient's needs. Another type of organization you can have is hospice. And this type of facility will care for terminally ill patients either at home or in a dedicated facility, like a hospice house, for example. And at hospice, the patients will receive palliative care. So you are making the person more comfortable in their final days before they pass away. So it's the relief and the prevention of suffering. And hospice care may include skilled care that's available 24 hours a day, 7 days a week. It may include pharmaceuticals to provide comfort for the patient, and any necessary medical equipment. And this is generally reimbursable by Medicare and Medicaid. Another kind of organizational structure you may have is a surgical center and an ASC, which is Ambulatory Surgical Center. So these specialize in outpatient surgical care. It's also known as same-day surgery. So you're able to walk into the facility, have the procedure, then you're able to walk out within that same day. So these will involve much less complex procedures than an inpatient surgery would, such as minor surgeries, pain management, diagnostic procedures. Nothing too involved that would involve an overnight stay, for example. Alright, now we'll move on to methods of operation. And these are the customs or practices that are used to achieve an organization's goal. This would include the scope of work for the facility, the availability of resources, and the formality of various procedures. When it comes to the scope of work, this refers to the task involved in accomplishing a goal or an objective. And differences exist in the scope of work among various types of medical facilities. So depending on what that facility focuses on, that obviously will determine their scope of work. Alright, in this table we have the scope of work for the identified organizations we've talked about so far. You have the type of organization here in this column, the type of disease or injury that would be treated, and then the residency. For example, a nursing home would treat a chronic disease or disability, and that's an inpatient residency. Home health care would be an assistance with certain treatments, and that would be done on an outpatient basis because you were treating that person at their home. We'll talk about the availability of resources. That's a reference to multiple kinds of resources, including financial, which is the economic and monetary resources needed for that organization to function properly. The human resources, which is a reference to the staffing needs that location would need. The physical resources, the actual physical locations and physical equipment that they need. And also the information that the facility would need. Alright, in this table we have the availability of financial resources for some various organizations, such as a general hospital would require a high amount of financial resource, either from endowments or numerous payers, such as patients, or gifts, for example. Home health care would require a low amount of financial resources because there's a comparatively low overhead and a low cost relative to the other types of organizations we talked about. So again, different kinds of organizations will require different amounts of resources depending on what their focus is. Right, regarding the formality of procedures, this is a set of established behaviors for collectively achieving the organization's goal. You can have either a high formality or a low formality. With high formality, there's little deviation from a set list of procedures. In low formality, there's a very high deviation from those set procedures. And formality will typically increase as the risk to a patient increases. On this table, we have a comparison of different kinds of organizations and the formality that be needed. Let's see, for example, a general hospital, there should be a high level of formality because you're talking about a higher risk acute care center. That compared to a hospice organization, that would be a very low formality because there's a low risk in assistance. You're really focusing on making the patient comfortable before they pass away. So again, the kinds of organization and what their scope of their work is will determine the kind of formality that is needed for proper care. All right, now we'll talk about codes of conduct. These are rules for behavior to which a group of people adhere to. And these may be very specific and written down. And this is likely to be similar for similar groups of people or similar facilities. So a pediatric hospital in, say, Florida or should have roughly the same kinds of conduct that a pediatric hospital in Hawaii or Alaska or California should have, because you're dealing with the same kinds of patients, the same kinds of procedures, so you would expect, or same types of codes of conduct, because you're dealing with the same general scope of work. And codes of conduct will frequently address proper communication, procedural behavior, social behavior, and also sanitation. When it comes to communication, what is considered to be professional communication, such as the proper use of written, oral, and other forms of exchange methods, different styles of communication, how something is said, the content of communication, what is said. When you have a high formality healthcare setting, you want to use a very formal kind of communication style. In these kinds of facilities, it would be inappropriate to discuss personal relationships, outside activities, or other staff members in front of the patient. That's considered to be unprofessional. And how you may talk to your friends should be a little bit different than how you communicate with your colleagues and also the patients. And this goes back to the professional communication. Right now we'll talk about adapting procedural behavior. And the level of procedural formality is based on the type of treatment or diagnostics that facility does. And some examples where procedural behavior is very, very important would be things like an imaging room or a procedure room, a recovery room, examination room, emergency room. Now this is just a very short list, but these 5 that are listed here not only want, but you need formality to be very high and for steps to be taken very seriously. Alright, now we'll talk about sanitation. Now some various methods of sanitation include the sterilization of the facilities and instruments that are used, and also the proper disposal of contaminated waste. Some other methods of sanitation include infection control procedures, such as hand washing, cleaning and sterilization of linens and instruments used, the use of antimicrobials, and also the use of protective equipment, gloves, masks, gowns, and so on. When it comes to social behavior and the sensitivity of the environment, social behavior is the conduct toward other people, whether they be colleagues or the patients. And of course, the social behavior will depend on what that person's role is within the facility. For example, it'd be inappropriate for a member of the emergency room to act shy around an unclothed patient. That should not be that big a deal because they're there to treat the patient. There's nothing that should be a concern. But that would be appropriate behavior if someone was on the maintenance staff, being around someone who is unclothed, because that's not a normal situation. It's not expected. All right, now we'll talk about conforming to management requirements. The main responsibility is the patient. Now, regardless of what kind of facility you're talking about, the main responsibility is the patient. And within each organization, you'll have a managerial operating procedure. These will address the business needs of the organization, and sometimes these may conflict with patient care. An example of this would be a private hospital may turn away a patient without insurance or without having a means to pay. All right, when it comes to protecting healthcare information, the HIPAA privacy rule protects individually identifiable health information. And this would include electronic forms, paper, and also verbal forms. And this relates to the past, present, and future health of an individual. And the PHI, the protected health information, is protected as long as it is retained by the covered entity. So even if that patient dies, that information is should still be protected by the covered entity. When it comes to healthcare team access, each member of a healthcare team has roles and responsibilities pertaining to the protected health information. So depending on what their role is, will determine how much access that person has to a patient's health information. Now, for example, on this table we have a variety of different health professionals and what kind of access they may or may not have to a patient's healthcare information. A medical doctor, of course, would be able to create protected health information, be able to read it and also to modify it. Since they are the doctor, they should be able to have unlimited access to this kind of information. Compare that to someone like a medical assistant. They cannot create this kind of information, but they are able to read it, but they cannot modify it. A nursing unit clerk, or NUC, can't create it, but they can read it, but they can modify it. So again, it just depends on the person's role in that facility, determines how much or how little access they may have to a patient's PHI. This is the continuation of the table we just saw. Other roles within a healthcare facility and what kinds of access they may or may not have to protected health information. Someone like a database administrator, of course, cannot create PHI, can't read it, and can't modify it. When it comes to business associate access, the HITECH Act, this will also encompass business associates of the covered entity. This applies to them also. Some examples of a business associate function: claims processing, accounting, accreditation, data aggregation. So the same rules that the covered entity, the healthcare provider, provides for the patient, the HITECH Act covers them, but also covers any kind of work that's outsourced by them, like accounting, like accreditation, and so on. They must follow the same stringent rules to protect the patient's data and keep it private. Now, when it comes to access limitations based on the role and exceptions, there are certain times where traditional access roles need to be superseded. For example, in an emergency situation, there may be a point where the database administrator may have to read the PHI because you're dealing with an emergency situation. Normally, that role would not have that kind of access to PHI. But in this situation, that's in an emergency, the overall goal is to care for the patient. So that rule is overlooked at that time because it is an emergency situation. All right, now we'll talk about access to sensitive patient data. Now, some information may have more stringent guidelines than others, and patients may ask a covered entity to restrict the use and the disclosure of their PHI. And the rules must be modified appropriately, depending on what they want to keep more private. So this goes back to the patient being able to determine who is and who is not allowed to have access to their personal information. All right, next we'll talk about proper communication. Now, procedures must be followed for various types of communication. An example of that would be backups. A permanent copy of all ePHI is maintained. So all electronic versions of protected health information must be maintained. There must be unique identifiers, so usernames and passwords for each distinct user account. And there must be procedures for obtaining emergency access. And this would be used for procedures for obtaining necessary information during an emergency situation. Now, how would someone who normally would not have access to the information, how do they access it in an emergency situation properly? Some other aspects of proper communication is timeout. This is the terminating of an electronic communication session after a period of inactivity. So you cannot have someone log in to a patient's information, leave it logged in 30, 40 minutes so anyone can walk by and access that information. There must be some procedures set up where after a certain amount of time where nothing is done, say at the computer for example, that person is automatically logged out to prevent unwanted access from unauthorized personnel. Another aspect here is encryption. All data on ePHIs must be encrypted because you're dealing with very private, very sensitive information. So the more security, the better. Another aspect is having an audit trail. This is a mechanism to record activity in information system. Who logged in when and how often and for how long. What did they modify, if anything, on the patient's record. So being able to track who did what and when, in case there are any questions later on regarding the patient's care. Another important aspect here is integrity. There must be mechanisms used to prevent unauthorized destruction or alterations of electronic PHI. Another aspect here is authentication. There must be procedures set to ensure those seeking access to PHIs are authentic. Another aspect is disposal. Having procedures set up to ensure final disposition of the ePHI. So once that record is complete and needs to be deleted, how is that deleted properly? Now, safeguards must apply to all forms of communication. Now, this would include email, any form of instant messaging, fax, file transfer protocols, telephone, or voice over IP. Okay, on this table, we have a list of different kinds of safeguards and various types of communication forms. For the safeguard of the timeout, where if someone is inactive for a certain amount of time, you are basically kicked out of being able to use that service. These numbers are noting these notes down here. So for email, you would use a timed screensaver to log someone out of that service. Same thing for an IM service, not applicable for a fax or phone. So depending on the method of communication, will determine the safeguard or safeguards that are used or should be used. All right, next we'll talk about data handling procedures and best practices for general technology use should be used. This is helped to ensure that the PHI is protected. Access to any kind of network device should be controlled, whether it be accessing the information electronically or physically. When it comes to the physical access of the hardware, the location of the physical device should be chosen to minimize access. You wouldn't want it in a very highly populated area or high traffic area. So being able to monitor who goes in and who goes out of a room where servers are maintained helps to limit any potential unauthorized use. Another safeguard can be used are privacy screens. These will prevent anyone not sitting in front of the screen from reading the contents. This way no one can look over your shoulder to see what private personal information that you are reading about a patient. Screensavers can also be used. These will lock out computer screens after a specified amount of time. This goes back to the timeout safeguard. You can also use time lockouts. This program will lock out users after a certain amount of time. In order to regain access, the person must log in again. Alright, that brings us to the end of chapter number 2 in this course. A quick summary of this chapter. Various healthcare organizational structures exist. Of course, they will differ on the scope of their work and what they concentrate on. A code of conduct refers to behavior rules to which a group of people adhere. PHI includes information in either verbal, paper, or electronic form. These will include the past, present, and future health information of a patient. Various roles and responsibilities exist for using PHI. Safeguarding communication methods is one facet of protecting a PHI. And the best practices in handling PHI in a healthcare setting involve controlling the physical and electronic access to personal computers, printers, servers, and other equipment that may be used. This brings us to the end of chapter number 2 in our video series. We will continue our course with our next video on chapter number 3, Desktop IT Operations.